My name was passed along to the White House to potentially be the representative from the state of Arizona for the President's Rose Garden ceremony. I thought it was an invitation to talk about health care policy issues, and I figured it would potentially be because they were looking still for alternative opinion. My personal information, including Social Security number and date of birth, and then so I sent that on one day. The next day I was then called, and they were excited to invite me. And I said, could you please give me more details about what's happening? And that's when they said they were looking for representatives from each of the 50 states who were physicians who were supportive of the President's plan. At that point, I wasn't quite sure what to say because it was clear that no one had bothered to Google my name, because I would certainly not be considered a supporter of the actual bills and plans that are being currently discussed by the leadership and the administration. So I did decline. It's disturbing to me that White House officials at any level wouldn't do even the slightest bit of vetting to see that people they were inviting to stand behind the President were actually genuinely supportive of the policies that they were expecting to stand for. Bring a serious question, first of all, at least for the folks who were involved in planning the event, how much effort they took to ensure that the people that they were really inviting, A, agreed with them, B, understood what they were being invited for. Because it is flattering to be invited to the White House. Frankly, it was tough to turn it down on the basis of that alone. I have not been there. I don't see an invitation forthcoming at any time in any administration. So I think it should draw into question, frankly, necessarily the degree and level of commitment of some of the physicians who will be standing behind the President in the Rose Garden. To me, to going there, and then I can say, hey, I was there, but I didn't really support it, then it moves the debate away from what it should be, which is that in health care, the details matter.
What are you doing instead on Monday?
Well, I'll be working actually to help take care of patients, since really, again, that's what we're about, which is trying to help get, in my case, take care of people with bone and joint problems. I'm on call.